For the introduction, and I'm delighted to be here today. As Jonathan says, I did work in the psoriasis clinic for many, many years, and also in our day centre where patients would come for topical therapies. So I have some experience across lots of different treatment areas. I'm going to focus on this primarily, I think, from the point of view of if you're going to be seeing a specialist, so you're going to a specialist clinic. But I think some of the points I'm going to make you can take to any healthcare setting. And indeed, as Jonathan mentioned earlier, the Psoriasis Awareness Week is focusing on treatments, and they want to hear your stories about what works and your experiences. And that includes your experiences about how to be prepared for an appointment, because I will have a perspective on this, but I think anybody who's been through the system will have some good points to share too. So please do get in touch with that initiative with the Psoriasis Association. So what am I going to cover? I am going to cover tips on preparing for your appointment, who you might see, why healthcare professionals ask certain questions, things that might happen in the clinic, and a checklist for the end of the appointment. So tips to prepare. I would suggest, if this is your first appointment in a specialist clinic, think about what it is you want to get out of this consultation. What are your priorities? You've probably got hundreds of questions. There may not be time for all of them. So just think about what's your main goal, what's your main priority, what bothers you most about the situation you're in. Is it that you're desperate for a clear diagnosis? You're desperate to access effective treatment? Is it that you can't actually function at home or at school or at work? What are your short and long-term goals? You might not yet have thought this one through, but it may be, for example, you're going to be getting married soon, and actually short term, you would like your skin to be as good as it can possibly be for that special occasion. But in the longer term, maybe a couple of years after the wedding, you might want to be thinking about starting a family. And so you might want to be having conversations with your specialist about what you can do, how your psoriasis can be managed effectively whilst you're starting a family. So I would suggest writing these things down, come with some questions prepared, and let the clinician you're seeing know that you have got some questions. There are some things you want to address in that appointment, so they can work that, plan to make time for that in your consultation. And it's very easy to forget things in a consultation when there's so much going on. So having that as a backup is terribly useful. The other thing I would suggest is consider what to bring to the consultation. So if you're on any other medicines for any other conditions, either bring a list of those or photos of them or a printout from the pharmacy, or bring the actual medicines in. It's really important for specialists to know about what other medicines you're on to help them know whether a treatment that they might like to prescribe for you will be safe to do so with those other medicines. And your history, your experience of treatments given to you for your psoriasis. So if you can, we may have some information about this in a referral letter from a primary care clinician, but you may have more details, and you will certainly have experienced those treatments, so we'll know what worked and what didn't work. So what gets a thumbs up and the thumbs down, but also how long you use those treatments and were there any side effects or complications. Because sometimes we revisit treatments because sometimes they weren't used long enough or they weren't used at the right dose. So all that detail is really important, and you are often the person that's got that detail to hand. If you are seeing any other specialists for any other medical conditions, it may be that we want to speak to them at some point with your consent, because it may be that that treatments we want to use, we might need some more information from them for us to use those treatments safely. We can always get this information after the event, but it's terribly useful if you've got that information to bring it along with you on the day of the appointment. And then I would also recommend you bring along pen or phone to write some notes on, and potentially a companion if you've got a lot of information to absorb and you're wanting to ask your questions. Sometimes a second pair of ears is helpful, or you can use your companion as a scribe during the consultation. So who might you see? Well, Catherine has already talked about primary care. So, you know, if you have mild psoriasis, it may well be you don't come to a specialist clinic and you're going to be seen by a GP, an advanced nurse practitioner in the practice, or sometimes within the practice, there'll be a GP who has a special interest in skin diseases. So a GP with I can't remember what the E is now. I'll come back to that in a minute. With an extended role, GP with an extended role. And in some areas, there will be a community dermatology service. So this is sort of intermediate to your GP and the specialist secondary care. And within that, there's normally a consultant from secondary care involved in that service, but it's often run primarily by a GP with extended role. So they'll have done extra training in dermatology, and often a nurse specialist or an advanced nurse practitioner in skin diseases will be involved in that service too. And then if you come to a specialist clinic, you may see a much bigger team. You may see members of single members of the team, or you may see multiple members of the team on your visit. And they will all have a specific role. But for first appointments, if you're seeing a specialist for the first time, there should be some consultant oversight of that, even if you don't see the consultant first. But within the clinic, you will hopefully have some nurses that are supporting, that have some background in dermatology, who, you know, you're going to be able to potentially speak to about how you use your treatments, how those treatments might be monitored. Very few clinics do have a specialist psychologist attached, but the team should be able to look at if you have needs for your mental well-being, signposting you to services that are available through primary care. There's often a specialist pharmacist attached to a service. They might not be present in clinic, but sometimes they will. You'll certainly have clinic nurses or healthcare assistants who will be doing things like blood tests and blood pressure. And a research active department will have research staff in the clinics as well, and they may approach you during your consultation to invite you to take part in research studies. So certainly in our clinic in Guy's, which is what we call a tertiary clinic, a specialist clinic, we have all of these team members. And the first appointments can be quite long because you may see several members of the team. Oh, I forgot to mention on that slide as well, of course, in a training hospital environment, you may well have medical students or nursing students present in the clinic, and you will be asked permission for them to be present in the consultation. But obviously, it's very important for our future generations of doctors and nurses to learn about skin disease. So hopefully you'll be happy for them to be part of that experience. So why do healthcare professionals ask certain questions? Well, we ask a lot of questions, but I've picked off a few here just to mention. So family planning can be an important part of life's journey, but also with your psoriasis. Sometimes psoriasis can get better, sometimes it can get worse with pregnancy. Some medicines you need to avoid pregnancy. So contraception is very important. And in methotrexate, I'll double check this with Catherine afterwards in the Q&A, but men have been advised not to father a child whilst taking methotrexate as well. So that's one of the reasons we ask about that, and that will inform decisions about which treatments might be suitable for you for us to discuss with you. Vaccinations. So we advise people to have certain vaccinations. For example, the annual flu vaccine and the COVID vaccine, particularly if they're going to have a medicine that's going to modify their immune system in some way. But there are some vaccinations actually you need to avoid absolutely if you're on those medicines, and those are live vaccines. So travel vaccines like yellow fever is live. You cannot have this once you're on one of these medicines, like the biologic medicines or cyclosporin. So planning ahead where possible to have vaccinations up to date before starting one of these treatments is really helpful. And depending where you come from in the world, you may have received different vaccines in childhood as well. So it's very helpful if you've got your vaccine background to be able to share. As with many clinics, primary care, all disease areas, lifestyle can play an important role in the disease severity, and we do see this in psoriasis as well. If people are drinking excessive amounts of alcohol, that can worsen psoriasis, and it can also have an effect on what treatment options are available, and we might need to monitor your liver more closely. So this is why we ask questions around alcohol and smoking. And then we ask questions around your medical history, particularly about any significant illnesses or cancer in the past, any forthcoming surgery, anything we need to help you prepare for. We might need to get your psoriasis better in a particular area for you to have surgery. And all your current medical problems and any allergies we need to know about too. So what might happen in clinic? A whole range of things, but as Catherine said, most importantly, we're going to look at your skin, and psoriasis can affect all areas of the body, including the scalp, the nails, and the genital area. And treatments will differ depending which area of the body is affected. So the topical treatments we use different treatments, for example, in the groin area and the face. We use different treatments in the scalp because it's a hairy area. So we do need to see all of your body when we examine you in a specialist clinic. And one of the other things we do in specialist clinics is we use this tool called a PASI, which stands for Psoriasis Area Severity Index. And this is something that helps us get a sort of objective measure or point of where your psoriasis is at that point in time. And this is useful for us to then continue to measure things to see if things are getting better or worse with the scores. But it's also critical to access to some of the biologic medicines. So that's one of the reasons we do this. And it's often nurses in the clinic that will be helping with this. Some clinics would also be using this questionnaire. It's called a Dermatology Life Quality Index. It's actually used for all inflammatory skin conditions, not just psoriasis. But it's 10 questions actually completed by you, the patient. And it gives us an idea of the impact that this skin condition is having on your life generally. So things like going to work or school, how much time it's taking to use treatments, whether it's interfering with relationships, and how it is affecting symptoms. And it can be a useful tool for us to use to start a discussion about how it might be affecting your mood and how you feel about your psoriasis more generally. But we also use it, again, with biologic therapies. We need to have certain measures, and this is one of them that we monitor when you're on biological therapies. As Catherine mentioned, joint disease, so a psoriatic arthritis can occur with psoriasis, particularly with severe psoriasis. So we want to know if there are any joint symptoms. Sometimes a screening tool called a PEST will be used in a clinic, but otherwise the doctors will probably ask you questions about your joints. They may have a look at your joints, like your hands, to see if there's any swelling or discomfort. And if there was a suspicion of arthritis and you weren't aware of that and hadn't been treated before, we would probably refer you on to a rheumatologist for further assessment of that. We monitor things like blood pressure and pulse, weight, waist size, and BMI, because all of these things can have a role in the treatments that we use. So some treatments like cyclosporin might make your blood pressure go up, so we need to monitor that. And we know achieving an ideal weight, we will be able to use treatments more effectively. So that's one of the reasons we do this. We may order blood tests for you so that we've got a screening background on how well your liver and your kidneys are, and how, if there's any sign of background infections that you weren't aware of. Again, these are always done before we start any systemic therapies. And then before you leave the clinic, what's really important, top tips are make sure you've got clarity about what the next steps are for you. Find out, what information do you need for using the treatments that you're being given, whether it's topical treatments, whether it's phototherapy, whether it's a systemic treatment. And if it's not available on hand, where can you get that information? Are you going to be coming back to this clinic again? And if so, can you have contact details for the service? And who is the contact that you should be in touch with if you have problems or flare-ups between scheduled appointments? What is the access point? It differs from every service. So it's nice to understand how you get back in the loop and how you access support and guidance. And then what are those follow-up arrangements? Are you going to be seen back in that clinic? Are you going to have a telephone follow-up or a video follow-up, which happens frequently and has done since COVID? And if that is being suggested and it's not suitable for you for whatever reason, flag that up and make sure it's important that it's made important that you come back and see somebody face to face. So in summary, make sure you are clear about what you want from the consultation, prepare your questions, bring up-to-date medical information, make notes as you go along, and ensure you've got a clear plan at the end of the consultation. Thank you.